Hi, everybody. Welcome to the Office of the Healthcare Advocate Lunch and Learn for October 18th, 2022. We're going to be covering issues of breast health with our fabulous nurse, Caroline Butler. My name is Ted Doolittle. I just want to tell you a little bit about the Office of the Healthcare Advocate. We're an independent state agency. We provide absolutely free services to anybody who is struggling with any health insurance or health coverage questions. They can be questions about commercial insurance or a public program, Medicare, Husky, any of the less common ones like TRICARE, even Indian Health Service. It doesn't matter. However you get your health care, we have a staff of nurses, attorneys, paralegals, consumer information representatives, and others who can help you just the same way a private attorney might, with advice or even representation in a difficult appeal. The only difference being that it's a state agency, so this service is absolutely free to you. Without further ado, I want to introduce Denise Ramatar, who's our Communications and Outreach Coordinator, as well as Caroline Butler, who is one of our wonderful nurse consultants. And I believe Caroline has the presentation today.
Thank you.
Go ahead.
Hi, I'm Caroline. I'm one of the nurse consultants at the Office of the Healthcare Advocate. Today's presentation is going to discuss the importance of breast screening, talk a little bit about Connecticut insurance laws and how OHA can help with any insurance denials related to any breast imaging testing or cancer treatments. I first just wanted to discuss a little bit about the different types of screening they have for breast cancer. So there's screening tests versus diagnostic tests for breast cancer. Screening mammograms are annual preventative exams, while a doctor may order a diagnostic mammogram based on any signs of breast cancer symptoms. A diagnostic mammogram is a more detailed than a screening mammogram for women who are experiencing symptoms or to follow up on abnormal screenings. Ultrasound is not typically used as a routine screening test for mammograms. Ultrasounds can be especially helpful in women with dense breast tissue, which make it hard to see abnormal areas on the mammograms. It could also be used to get a better look at a suspicious area that was seen on a mammogram. There's many resources and information that you can find on the American Cancer Society website. Connecticut insurance law related to breast screening. So this is part of the current law, and there's going to be some significant changes starting in January 2023. So currently, the Connecticut law requires certain health insurance policies to cover a baseline mammogram for a woman aged 35 to 39 and one every year for women 40 or older. And there was changes back in 2017 to allow for women to have a 3D mammogram, which is a more detailed mammogram. The policies must additionally cover a comprehensive ultrasound of a woman's entire breast. The mammogram shows heterogeneous or dense breast tissue of the breast imaging reporting data system. It's often referred to as the BIRADS, which was established by the American College of Radiology. So women who are at increased risk of breast cancer due to family history, her own history, genetic testing, or other indications determined by her physician or APRN. They must also cover MRIs of a woman's breasts, and this is in accordance with the American Cancer Society guidelines. This is also more of the current law information. Under the state law, benefits payable for breast screening services are subject to any policy provisions applying to other covered services, except a policy cannot impose a copayment of more than $20 for breast ultrasound screening. The state law applies to individual or group health insurance policies delivered, renewed, or amended, or continued in Connecticut that cover basic hospital expenses, basic medical surgical expenses, major medical expenses, or hospital or medical services. including those provided under HMO plans, individual health policies that are provided limited benefit health coverages. The state law does not apply to, and this is important in Connecticut because many people who live in Connecticut have, self-funded plans. I think it may be up to 60% of people living in the state. This law does not apply to employer-sponsored self-funded plans, also called ERISA plans, Medicare Advantage plans, and plans written in other states. For instance, coverage if you have is through an out-of-state employer. Changes to the Connecticut law starting in 2023, and this applies to breast and ovarian cancer screening. This act expands coverage requirements under certain commercial health policies for specified procedures used to treat or prevent breast or ovarian cancer. It expands health insurance coverage requirements for breast mammograms, ultrasounds, and MRIs. Requires coverage of certain procedures related to breast cancer treatment, including breast biopsies, certain mastectomies, and breast reconstruction surgeries. These are subject to certain conditions. And it also requires coverage for genetic testing, including the BRCA1 and the BRCA2 gene under certain circumstances and post-treatment monitoring. It also covers routine and ovarian cancer screenings and including certain surveillance tests for certain insured people. This new act is prohibiting the policies from imposing cost sharing, co-insurance, co-payments, deductibles, or other out-of-pocket expenses for the above covered services. This cost-sharing prohibition applies to all affected policies, but it only applies to the high deductible plans to the extent the federal law permits. So as long as it does not disqualify as a medical or health savings account from preferable tax treatment. And lastly, the act makes minor changes, including adopting general neutral language, specifying that the mammography, ultrasound, and certain other coverage requirements apply to any insured and not just women. The act requirements apply to fully insured individuals and group health insurance policies delivered, issued, renewed, amended, or continued in Connecticut after January 1st, 2023. Information on the current and the new Connecticut law can be found on the website on the ct.gov website. The next part I wanted to just review is the Connecticut breast cancer rates. In Connecticut, our rate is very high. So according to the Connecticut Department of Public Health, Connecticut has the second highest rate of breast cancer nationally. So this is a very huge problem in our state, that our rate is so high compared to any other state in the U.S. Breast cancer is the most common cancer in Connecticut women. Incidence rates are higher in Connecticut compared to the entire U.S. And in Connecticut, breast cancer is the second leading cause of cancer deaths in women. Women living in the United States have a 12.3% or 1.8 lifetime risk of being diagnosed with breast cancer, comparable into the 1970s. The lifetime risk of being diagnosed was 1 in 11. The one thing that has happened over time, especially since the 1970s, is that the breast cancer survival rate has increased tremendously. And currently the 5-year survival rate for women with breast cancer is 98%. The best defense against breast cancer, of course, is following the guidelines of having a first mammogram between the age of 35 and 39, and then having a mammogram once a year thereafter. How OHA can help. OHA can assist with insurance denials for cancer screening, imaging, medications, chemotherapy, radiation, treatment, or any denial. OHA can help consumers understand their plans and what their plan covers based on is self-funded or fully insured. It can be very difficult to understand the type of plan you have. It's not always easy to tell based on your employer if your plan is self-funded or fully insured, so we can help you to determine that if it follows the state of Connecticut mandates. We would be able to help assist you with that, and we can also help you assist with appeals for any breast cancer denial, or even if it was a breast cancer screening or mammogram or MRI. OHA can assist you with helping with those claims. I just want to thank everybody for joining us today and attending this presentation. I'll take any questions from anybody. And we do have the lunch and learns every month, once a month. Our next month's lunch and learn is going to address and go over the open enrollment. Does anybody have any questions? You're on mute, Denise.
Feel free to ask your questions in the chat as well, or email us, as you see here, at healthcare.advocate@ct.gov. If there are no questions, thank you so much for coming, and we'll see you at the next lunch and learn.